This is Dr. Mohebi from Mohebi Hair Restoration. We have a 2000 FUE case for a gentleman who does not want to look bald in the future. Procedures we do more and more these days for younger people who know they have a strong family history of baldness, and microscopic evaluation shows that they're going to go bald there yet, but they want to prevent even anybody guessing that they're going bald. So we preventatively go and give him hair transplant. He has nice coarse hair, but in front he has some thinning that he's coming forward to hide them. Corners, a little bit of thinning. The top view, it's not too bad. The crown, you see some baldness here. So that's the area, that's the most visible area. The worst view, how people see him from the back, the crown area. We do miniaturization study or microscopic evaluation of the scalp that tells us where people are heading in the future. Evaluation, we want to see what's the thickness of the hair shafts. If you see a lot of baby hair, a lot of miniaturized hair, we know there is future chance of hair loss. But if it's combined with family history, it's a very good, basically, predictor of future hair loss. So by use, this is it gives us 50 times magnification. See it under microscope, the hair thickness. Myself on my scalp, so you see how the hair will show. We part one area and put the microscope here, and we look at the numbers. How my hair looks on the back, you see they're pretty thick. If you move around, you see some shininess of the skin, which is pretty normal in healthy skins. We don't see a lot of baby hair. Everything is pretty thick, and we don't see a lot of miniaturization here. How it's compared to the frontal hair, the area that I have a little bit of miniaturization, and down the road I probably recede my hairline a little bit. Exactly what happened to my dad. So in the front you see a lot of single hairs and some baby hairs in between them, more gaps and more baby hairs. This is miniaturization. We go toward the back, we see less miniaturization, more thick hair, which shows that I probably will not lose those areas on top, but in front I will have some recession. This is how we chart his miniaturization study on patients. In this patient, he has 90% miniaturization on the hairline, corners 90%. Yet definitely he's gonna go bald in those areas. On the top area, he have 30%, which is a little bit more than normal, which is 20%. 20% is the level of miniaturization. So in this case, on the top areas, he has 30% miniaturization, which is a little bit more than normal. Probably he will lose more hair. On the crown area, he have 90%, which is gonna be bald in the future, and the donor area is obviously only 10%. And on the crown edge, 50% miniaturization for 2 centimeters. On the crown area, at the edge of crown area, he's going to expand that balding patch a little bit more down the road. Miniaturization study, we can very precisely say what's going to happen to the pattern of hair loss in this patient in the future. Master plan helps us be prepared for future hair loss and guarantee that the patient can always have reasonable coverage everywhere on the scalp. Replacing the grafts, he's getting beautiful grafts, a lot of 2s and 3s, and they're all being placed in front, and then we do it in the crown later on. So they're being placed in frontal area, and then we're going to do it in the crown later on today. We are putting the frontal area for 800 grafts and 1200 grafts on the crown area. Today is called serial extraction and placement, meaning that we extract for an hour or two, and then we place everything that we extracted. Extraction and placement helps us to minimize the time the grafts stay out of the body and helps the survival rate. This is the third pass of serial extraction and placement, and the last one. We're shooting for 2,000 grafts, already about 1,600, and we're going to be finishing soon, and then we're going to put them with implanters. 2,000 grafts in to cover the front and crown area. Let's look at it from my camera. Front is nicely dense, but in a narrow area. This is the top area. You see the crown is nicely covered with 1,200 grafts, which is going to be making a good coverage.